A very good morning to all of you. I am Sayukta from All About Skin Wellbeing, and I'm sure all of you must be doing really good. We all know that taking good care of your skin is important for more than just our appearance. As the largest organ, our skin becomes the most essential to our overall health. A fungal infection is quite common on our skin, nails, many a time scalp. But fungal infections or mycosis are diseases caused by a fungus, yeast, or mold. Mild fungal infections can look like a rash, can be really itchy and annoying. So, to know about what is fungal infection, what is the right way to manage, how to prevent, etc., let's connect today with our skin expert, Dr. Nikhila Sandeep, live from Calicut, Kerala, to enlighten us on the topic of fungal infection. Dr. Nikhila Sandeep is an MBBS, MD, DNB, MNAMS, and she is a medical professional associated with Turkey Cosmetic Clinic, Calicut, Kerala. She has 10 plus years of experience. Her expertise includes dermatology, where she addresses various skin concerns, including so many, aesthetics, etc. Today, Dr. Nikhila Sandeep will share with us on fungal infection prevention and treatment. A very warm welcome to you, Dr. Nikhila Sandeep.
Thank you. Thank you for the nice words of introduction.
Doctor, we all know, wherever the climate is right now, because we all are experiencing heavy rains, moderate rains, etc. And this is the weather where, due to humidity, because it's humid, we are sweating a lot, it's raining, the weather is continuously changing, and we also see rapid surge in fungal infection cases. So I think this is the right time to understand what is fungal infection, how to prevent it, how to manage it, etc. So to start with, doctor, what is fungal infection, and especially during this weather, what precautions we need to take?
Okay, so fungal infections are any disease in humans caused by a fungus, but there are various names for it. For example, if the fungal infection is of the scalp, it is known as tinea capitis. Tinea means it is just a round, that is ring type of infections. Then if it is of the body, it is known as tinea corporis. If it is of the groin, it is known as tinea cruris, or commonly known as the jockey itch. And if it is in between your toes, it is known as athlete foot. So there are various names for it, but it is almost one and the same. And sometimes it can even affect the nails, where it is known as onychomycosis. And even there are milder fungal infections like this dandruff, seborrheic dermatitis. And there is another condition known as tinea versicolor, which is usually asymptomatic but dark light colored skin patches with no much symptoms. And you can understand fungal infections by the symptoms. That is very important because the treatment of other infections and fungal infection is different, and the course of treatment is also different. So how to understand is that by the appearance of the lesions. Usually it starts as small, itchy, red lesions, which gradually increase in size. And there is a peculiarity of the increase in size of these lesions. They become ring-like. That is very important. And it is extremely itchy, especially when we remove our clothes or just soon after a bath or after sweating. So this is very important for you to understand. And the next thing is the precautions. So what are the precautions you should take before or to prevent the occurrence of fungal infection? So first thing is you should always wear loose clothes, especially if the climate is humid. You should wear cotton clothes. Avoid synthetic clothing. Why is it so? Because this cotton clothing usually absorbs the sweat and moisture from our body, but the synthetic clothing leaves the moisture there. This moisture is very essential for the fungus to grow. The second thing is the body folds should be especially taken care of, especially those who are obese, that is those who are overweight, or those who have these immunosuppressed conditions like diabetes, which can worsen these fungal infections. So the body fold should be kept completely dry, and you can apply some like talcum powders or antifungal powders to prevent the infections. And if it is of the nails or toes, especially wearing these socks and shoes in the monsoon, should be avoided. And you should wear open sandals type footwear. And the feet should be completely dry, especially while you are sitting in the home or like office. While walking, it's not possible, especially in this heavy monsoon. And the other precautions you have to take is you should not apply any over the counter medications. If at all you have any of these symptoms like itching over the groin folds or any ring like lesions over the body or in between the fingers and toes, you should consult your dermatologist and they will give you a prescription of medicines. Usually these medicines last for about 4 to 6 weeks. So even if it all you experience relief of symptoms after 2 weeks or so, you should continue the medicines prescribed by the dermatologist because that is very important for the complete clearance of the lesions and the fungus from our body because it takes that much time. That is minimum of 4 weeks for the skin to shed and new skin to form, and that much time for the fungus to get rid from our body. The other precautions you should take in case if you are experiencing fungal infections, that is, you should not share your clothing and you should not share your personal items like comb, towels, etc. with someone else. And the other thing is you should wash your clothing in hot water, at least around 60 degrees Celsius hot water, and it should be completely dry before you wear it. And you can iron your clothes preferably in this monsoon where the clothes are not getting completely dry. And also, you should avoid using this hot water to your body or even antiseptics to your body because it does not eradicate the fungus from our body.
Okay, so these are the things that we can do to prevent fungal infection. And plus, in case you have fungal infection or any member of your family, again, you need to follow the prescriptions, precautions as doctor has advised. Now, doctor, you also mentioned it, a very common tendency in our society because, over-the-counter medication is so easily accessible, available. We all go for it, and we all understand also deep down that it's not a good thing. But then we would like you to shed some more light over how harmful can these over the counter topical applications that we get and we keep on applying it for months before landing up in front of a doctor, how harmful, how bad can it go?
This over-the-counter medication, so usually they contain steroid. That's a problem. If it is just an antifungal medicines, that is fine, but to an extent. I will talk about these two things separately. First is about the OTC medication containing steroids. What happens is that when we apply a steroid to any inflammatory lesion, the body suppresses that inflammation for a period of around how much time the steroid is being applied. But after that, what happens is that there is a recurrence of that lesion and it can worsen the existing fungal infection because the fungus is there, it is not being killed, and it gets worsened and it progresses rapidly than it was previously. So, and the patient, why the patient applies is that because they get a temporary relief following a 1 or 2 day application. That's why most of them go for this OTC medications. Second thing is, if it is the antifungal you are using, it is good. It is not bad. It actually suppresses the fungus. But now there are so many resistant strain of funguses. Like usually it used to be like a simple fungus known as Trichophyton rubrum. But it is usually seen in humans and it usually gets treated within a period of two weeks, usually with topicals. But now the problem is that there are so many resistant strains of fungus which responds very mildly to these agents. So there is a decrease in symptoms following application of such medicines. But as soon as you stop the medications, there is recurrence of the symptoms as well as this lesion spread far and wide over the body. And also the problem is that there is chance of resistance of the fungus to these agents. So next time when you apply this same ointment or cream or what the molecule, the fungus does not respond to it because the fungus has evaded the mechanism of action of this drug and it can grow even in the presence of such medicine. So the doctor will have to use other medicines to treat the same. So it is a problem for the patient as well as the doctor. The doctors, especially we dermatologists, find it very difficult to treat such resistant fungal infections. So while
Right.
better not to spend your money twice, like first you have to do this OTC medicines and then again you are consulting a dermatologist and taking a long course of treatment. And by that time, it would have been 1 year or so of this fungal infection. The patient would be suffering from this fungal infection, and also the patient would be transferring this infection to his household members also.
Right. So that risk is always there, transferring the infection from you to others, to your family members, colleagues, etc. So that risk is there. So the easiest way is A, please go to a qualified dermat who can help you treat, get relief of your fungal infection. B, take care of your hygiene. Personal hygiene is very important. Of course, I think that comes even before you go to a doctor. Please maintain personal hygiene. That's really important. Now, doctor, what happens? Another very common tendency of our society is, I'm sure you also get patients like that. For example, you have prescribed them a medicine for 4 weeks or say 2 weeks. Say I'm the patient, I'll follow the prescription for a week, I'll see the surface or the fungal infection is subsiding, or I've got relief, so I'll immediately stop for the medication. I won't even keep the doctor in loop. I'll because I feel that it's done, it's over. Now again, in case I get the infection, I have the prescription now, so I can go easily to a chemist shop, get the medicines, and start the medication all over again, all by myself, not keeping the doctor in the loop. Um, Another very important problem that we faces in our society is that I'll go with what my family has, done, their prescription, my friend's prescription. So that is again a very common tendency. Now, stopping the medication all by yourself, starting over it again all by yourself, do it really work that way, or it's hazardous?
The thing is, if the doctor usually nowadays, we dermatologists prescribe for a period of 4 weeks, because that's the time taken for the fungus to get rid from our body. The thing is, they will get a symptom relief within 2 weeks, usually within 14 or 20 days, and after that they tend to stop the medicines. Like 50% of them, usually they will be having sometimes mild infection, they would have taken the treatment early, then they would be completely free of the disease. But the other patients will have a recurrence of symptoms. So one thing is, they will take the medicine again with the same prescription. That, as I already told, it can result in resistance of the fungus to this particular medicine. So next time when you go to a doctor, he may again give the same medicines, but they may have to take it at a longer duration, that is 6 weeks or 8 weeks, sometimes even up to 3 months, or they will have to take a higher dose, or the doctor may have to change the medicine to another molecule which the fungus may or may not be resistant. Again, we can do tests based upon the resistance, but that test is costing like 1,500 to 2,000, that vary upon the lab. So better, why you have to spend so much money? There is no need to spend so much money when you can just consult your dermatologist at the right time and take your medicines for the prescribed duration. Then you can get rid, and also follow the general measures, you can get rid of this fungal infection. So better go for that. That is what I have to say from this platform.
Right. So, A, you need to follow the rules of personal hygiene, take care of yourself, your clothing, etc. B, in case you still have fungal infection, please go to a qualified dermat at the first place. Do not self-medicate. Do not go for DIYs or home remedies or over-the-counter medication. C, trust your doctor. Follow the prescription, follow the treatment. That's really important. Now, doctor, because we are talking about fungal infections and people have so many common questions. A very common question people often ask is, because again, in terms of home remedies, we are so obsessed with coconut oil or applying, oil or some kind of gel. So whenever, as soon as we see any kind of infection which is itching and which is on our skin, we would love to apply oil, whether it's on our scalp, on our skin. Is it a good idea in case it's a fungal infection? Because initially you said that moisture gives a good condition for the fungus to grow. So is it a good idea?
Same with that, same as moisture, oil is a good medium for the fungus to grow. So you might have noticed, people might have noticed that applying oil to the scalp, excessive oil to the scalp, can increase in dandruff, can cause increase in the seborrheic dermatitis dandruff. Again, body also, you should not apply oil if you are experiencing fungal infection, because that acts as a growing medium for the fungus. So during that time, it is better to avoid oils on that particular areas all over the whole body.
Okay. And doctor, do fungus, I mean, from one person, fungal infection can, transfer to the others. But from one body part to the other body part, is it also easily transferable? For example, I'll have fungal infection of my toes, and soon I'll see fungal infection between my fingers or under arms, etc.
Yes, it is a very common thing to occur because usually if the patient is having a fungal infection of a groin fold or something, gradually, like over a period of like 1 month or 2 months, it can gradually spread to other body folds. That is one part. One important factor is that there is a genetic predisposition for this fungal infection. Second thing is because this clothing gets in contact with the multiple body areas, and the fungal spores, that is the eggs of the fungus, will remain in that clothing. You have not washed it properly in hot water or ironed it. This heat is the important thing which kills the fungus. So if that has not been done, it can transfer from one body part to the other. Also, the body condition like increased sweating, the way of clothing, that is, if the patient is using synthetic clothing more, or if it is a tight clothing of the, or if the patient is having other factors like diabetes or obesity, all these can contribute to the spread of infection from one part of the body to the other.
Okay. Do toddlers or kids also get fungal infection? And in that case, what to do? Another thing with kids is their fungal infection of scalp is quite common in them.
Yeah, fungal infection do occur in kids, especially from transfer from the adults. We have seen so many fungal infections even in newborns where this fungal infection had occurred from the those who take care of children during that time, their nannies, and also from parents. Also, they are getting fungal infection. Again, tinea capitis, that is a fungal infection of the scalp, is common in toddlers. Because usually their scalp is more prone for fungal infections than their body, and it occurs as sometimes as patchy hair loss, or sometimes as big abscess and pustule formation of the scalp. Again, it is a very it is a condition which can cause scarring hair loss. That is, hair can be lost completely from that area for permanently. So you have to treat it at the starting of the infection itself.
Okay. Fungal infection of groins or vaginal yeast infection is also very common, doctor, but then people are so, hesitant in talking about it and going to a doctor and get it treated. Would you like to shed some light on that and make people aware about it?
Vaginal infections, that is vulvovaginal candidiasis, usually caused by candida. It is very common in reproductive age group of females. The most important factor again is a host factor, that is a body type of the individual. Then it is associated with blood sugar levels, that is diabetes. There is chance of recurrent vulvovaginal candidiasis, and there is a condition known as a loss of normal lactobacilli present in the vagina. If that decreases, there is increased chance of that candida. That candida is normally seen in the vaginal smear in our body. That is in a very few quantity, but if that becomes excess, that can cause this fungal infection known as candidiasis. So that presents as severe itching of the vulval area associated with curdy, white, thick discharge from the vagina, and it is it exacerbate during the or premenstrually, that is just before the menstrual phase, it exacerbates, and soon after the menstruation there is a slight decrease in symptoms. Usually the patient will have to take medicines for that. They may have to take intravaginal medicines along with that, a course of antifungals for a period of 2 weeks. And again, you can we give topical applications, antifungal creams to apply also. And to prevent recurrence again, the cause as already mentioned, usually the decrease in immunity of the patient, as well as factors like diabetes or increased blood sugar levels. So that you have to correct it. Along with that, the patient have to continue the medicines as prescribed by the dermatologist for that duration. Usually we give for 2 weeks and the patient will get complete relief of symptoms.
So yeah, as we were talking about fungal infections, and people have so many questions about fungal infection, viewers are asking so many questions. I'd like to take them one by one. So one of the questions that one of our viewers asking is, how do we know that the fungal infection is healing?
Yes. Initially, first for that, you should understand how a fungal infection will look like. Initially, it will appear as a small reddish patch that is around 1 or 2 centimeters, and it gradually increase in size, and the center of the lesion will clear. That clearing looks like a light brown patch, and the edges will be a reddish and raised. But that when the fungal infection is clearing, that redness of the edges will gradually come down, and the thickness of the edges will come down. It will become flat, and it will not advance further. So that is the first sign. And gradually it will come down, and it will just start scaling. That is, a few scales will come off from that. But the raised appearance will not be there. It will become completely flat along with the skin surface, and it will become darkish brown in color. So that is when it starts healing. But the fungal elements will still be there. So it will take around 2 weeks of medicines for this change to occur. But for further application of the ointments or creams for a period of 2 weeks and taking of tablets will result in complete normalization of the skin, and slight light wheatish color will remain for a period of 1 month or so. And by that time, the fungal infection would have been completely cleared.
Right.
I'm saying
And another
4 weeks because usually the skin shedding time is 28 to 30 days. So that is why I'm saying like you should take the medicines for a period of 4 weeks. Sometimes for some patients, it may take up to 6 weeks for complete clearance of the lesions. Okay.
Fair enough. Another viewer's question is how to avoid or prevent fungal infection in gyms.
Okay. So one thing is avoid sharing of clothing and towel. You'll be taking your own clothing to the gym, as we all know, but towels better to avoid sharing. And also for those instruments in which you are in close contact with the body, you can use an extra towel to apply over that area so that you can directly prevent the contact with the body. Third thing is, as soon as you reach back from the gym, you will be very sweaty. You have to bathe yourself with soap and water, and then completely dry your body and put on different clothing. And this clothing which has been used in the gym should be washed in hot water daily, and should be completely dry before you wear on the next day. And that's enough. All these things will help you prevent fungal infection from getting from a gym.
Okay. Another question by a viewer is Firoz Khan is asking, can you get a fungal infection from swimming pools?
Swimming pools, usually this infection won't happen from the pool because it is chlorinated water. Usually the common area, that is the changing area, from there is one chance of getting fungal infection from changing area, especially of the feet, because these fungal infections in some patients are common in the interdigital spaces, that is in between the toes. So by using the same, because we may not be wearing footwear during that time, so there is one chance of infection from over the foot, that is athlete's foot can occur. And the second thing is, if you are not changing to your clothing soon after reaching home, that can also because you are wearing the wet clothing for a longer period of time, that can also exacerbate fungal infection. Otherwise, there is no chance of getting infection directly from a pool.
Fair enough. So you need to take care of yourself and try to follow all the prevention tips. Yes. Now, doctor, because we are talking about fungal infection, and in bits and pieces, we have also spoken about fungal infection of scalp. But in detail, would you like to elaborate scalp fungal infection a bit more?
Scalp fungal infections, usually there are 2 types. That is a superficial fungal infection known as the seborrheic dermatitis or dandruff. Dandruff is this dandruff is caused by a fungus known as Malassezia furfur, which is a normal resident in all 90% of the people. So this symptoms occurs when this Malassezia becomes overactive and the host cannot tolerate it. Host immune response is what we see. That is, some patients may respond to as just a mild flaking in the scalp, but some people respond to it as severe redness, scaling, itching, and some small red raised tiny lesions, and even pustule lesions can occur in some way. That depends upon the are factors, that is the host factors. So usually the treatment of this, the second type of fungal infection of the scalp is known as tinea capitis. That is, it is the same, the fungus which is affecting our skin, that is tinea, that is affecting the scalp. It can present as multiple small tiny patches of hair loss in multiple areas, which is severely itchy. And sometimes it can occur, as already discussed, as multiple pus-filled and abscess-like lesions over the scalp. And again, treatment of both is different. Usually, the seborrheic dermatitis treatment is mild antifungal shampoos containing ketoconazole or uric acid with zinc pyriton, etc. And it can be done every weekly or twice weekly. And also sometimes if the symptoms are severe, you can go for some antifungal orally. That's enough. And this treatment is like it's a long-term treatment, because this fungus is a normal resident of our body. So when the fungal population increases, our body will react to it. But the tinea capitis it's a completely curable, it's a one-time condition. Usually the same treatment as the tinea of a body, 4 weeks to 6 weeks duration of treatment. Usually this is more common in children and elderly people. So a course of antifungals along with antifungal ointments or even shampoos can help. And that too, it should be taken for a period of 4 to 6 weeks.
Right. So this was all about scalp fungal infection. Now, doctor, if you can just, tell us one more time, do's and don'ts, what to take care of, how we can take care of ourselves and prevent fungal infection.
Okay, the do's are usually what I tell my patients is that you consult your dermatologist, you take treatment as prescribed by the dermatologist. That is, if she or she prescribes for a period of 4 weeks, take it completely. And if sometimes the doctors may be a bit doubtful if the lesion will go in a period of 4 weeks or 6 weeks. So they will ask for a review. So that also you follow up this thing. And do wash your clothes in hot water so that it does not spread to you back or to your family members. And it should be completely dry before wearing it. And do wear cotton clothes. Then you should not, that will come under don'ts. I'll say about the don'ts. Don't take OTC medicines. And don't wear tight clothing. Don't wear synthetic clothing. Don't share your towels and combs with other people in your family or in your room. And so these are the do's and don'ts in case of fungal infection.
Fair enough, doctor. And doctor, before we wind up the whole session, any take-home message for our viewers?
I would like to tell my patients and viewers the same thing as always. This fungal infection is caused by an organism which affects our body, and it should be completely removed from our body before it spreads to other areas of the body to another members. So take your medicines, you consult your dermatologist, not a GP or not a pharmacist or anybody, not your neighbor, like that. You consult your dermatologist, you spend that money, you take your medicines completely, and you get rid of the fungal infections. Okay, then also always follow the general measure. General measures are very important in case of fungal infections, because these fungus from the body we can remove it by the medicines, but it cannot remove the fungus in your clothing, in your personal items. So those should be disinfected so that you cannot get a recurrence of the fungal infection.
Right. So taking care of yourself, maintaining personal hygiene, and in case you have fungal infection, then contacting your doctor, a qualified dermat, is really important, and following these steps, as Dr. Nikhila Sandeep has very well explained already, is indeed very, very important. Thank you so very much, Dr. Nikhila Sandeep. It was such an informative session, and especially I think during this weather, it becomes even more important to talk about fungal infection. Thank you so very much.
It was a pleasure in joining you all. Thank you.
Thank you, doctor, one more time. And viewers, thank you for your active participation. Stay happy, stay healthy, and take good care of yourself. Have a good day ahead. Goodbye.